If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you. Hey man, how's it going?
It's going well. I'm here in Nashville. I slept in my bed last night. You're traveling the world.
Man, it's been, yeah, it is. Yes, it has been a week. It has been a week. It started on Sunday. I arrived in Austin Sunday afternoon, actually, for the HFMA Leadership Summit. And we had a really good event and board meeting, and we ratified the board votes. And so I think I'm now officially the chair-elect of HFMA.
Oh, congratulations. That's good.
Thank you.
Yeah.
And had a great panel. So that was great. Then I flew to Salt Lake for Celtic Bank board meeting. And then I flew to San Juan, Puerto Rico for some stuff that, will probably come out in around July, but some stuff that I'm working on. And now I'm in New York. So I think this is the first time I've ever done like 5 cities in 5 days. But
right. That's a significant travel.
Yeah. No, it's been crazy, man. And now I'm in New York because tonight we have a celebration dinner for the great growth financing for IntisCare, where Blue Star Innovation Partners is the latest investor and basically executed a growth majority round. And we're really excited about that. And so celebrating with all of the early investors and the management team. So
yeah, that'll be a fun dinner. Those are the best parts of being a venture capitalist. Like after the money's out, and you still have an opportunity.
We're still in.
Keep going with them. Yeah, but we've gotten a lot of money out, so it's good. It'll be a fun dinner.
I'm staying on the board. So but yeah, it's that should be fun. So that's just gonna be right around the corner. You've been fighting through our audit. That's fun.
Yes. It's every year this time I'm going through this. Every year I say I'm going to try to be more planned next year. And I don't know. I think the more planned I am, the more questions I ask.
Yeah,
it's healthy, but it just, I don't know. It always goes to the last minute, no matter what.
I observed that you were in fact more planned this year. You truly were. And
we're here on the 30th.
And here we are.
And
here we are.
Same result. It's always the last second. Yeah.
Anyway, it has been a busy week out there in the world. We had to be thoughtful about what we included because we could have included so much more. It's like that every week now. But I'm excited to walk through the news with you. You ready?
Yeah. Let's go.
All right, let's dig in. So starting with the Fed, Jerome Powell is going to remain on the Fed board. We talked about this last week when we talked about the confirmation hearings for Kevin Warsh and debated, not really debated, but just kind of discussed whether or not we thought, Powell would stay on, and he's clearly staying on. And he's staying on for reasons that I think, and I kind of said this last week, may resonate with other members of the board, which is concerns about the Fed's independence, right? And the chair alone cannot assure it. And clearly, if Powell thought the chair could, he would have probably stepped down, which is the customary thing to do.
Yeah, I think it's partially that. I think it's partially he is concerned about the law kind of suits around the building process that have been suspended, but they could be turned back on. I mean, it wasn't really fully dropped. And so we'll see. I mean, I'm hopeful that he's allows the process to continue, but we'll see. And hopefully Trump won't restart the lawsuit after Warsh is approved.
Yeah, that would be great, especially since he's not the Fed chair anymore.
Yeah. Well, and I don't know anyone that believes that Jerome Powell is actually doing something inappropriate. I mean, maybe the project is spending a lot of money. I'm doing a building project right now that's spending more money than I wish it was spending.
Right.
But I don't think it's like any intentional fraudulent things. I just can't imagine that. So
yeah, and look, I mean, I recognize that it hasn't been initiated yet, but it is to I think the general public who even knows about this, who even knows who Jerome Powell is. Shouldn't even say general public, but to those in the public who are aware of this whole situation, juxtaposing that with the whole discussion around the White House ballroom, obviously, heated up by the attempted assassination on President Trump. It's just kind of like, why would we continue that, right? Like it seems like he really wants to get that ballroom done, and that probably means he can let this thing with Powell just right off into the sunset.
That'd be better for the entire country, I think.
Yes. So World Health Organization, NATO, UN, all of these institutions that we grew up with as just sort of fixtures in the world order, all fraying in this moment in time. And now one that, like, I don't know. I mean, I don't know that I even understood that it could blow up the way that it's currently blowing up. But the U.A.E. is exiting OPEC. And this is really starting to illustrate the complexity of the Middle East as a region, right? If you try to draw the lines there along very simple alignment lines of, hey, all of these countries are, Muslim countries, and so they all get along and they all collaborate. Clearly, you don't understand enough about the region and about these different countries and about their history and about, how they got to where they are today and what the war that has broken out really has exposed about that region. I mean, this did not take very long at all in terms of like how many weeks we've been in this war for the U.A.E. to declare that they are exiting OPEC.
Yeah, that's right. I mean, I think it's a voluntary consortium partnership, so they can elect to not participate anymore. But I agree, the region is complicated and getting more complicated. I used to think it was as simple as Sunni and Shia, and it's not. I mean, it's not as simple as that even. So yes, it's each country has its own sort of geopolitical and economic concerns, and even Saudi Arabia and U.A.E., which are right next to each other and traditionally pretty close, are on opposite sides of this topic.
Yeah, it's amazing. I mean, and this to me is a major sign of the rift, right? I mean, OPEC. I don't know how long all the members have been a part of OPEC, but OPEC's been around since like the 60s.
Yeah.
This is a long-standing alignment. So truly a new era that we find ourselves in.
Yeah, and I think you're right. The global order, all the institutions that were created after World War II, they're all fraying right now. This particular one, I think, will be okay for U.S. consumers because oil's really high right now because of the war, but OPEC has been keeping it higher than it naturally would be. So if that phrase, that might be okay. But in general, all our institutions are, losing power.
Yeah, I mean, it's a blow to the region, right, though? So that kind of consistent destabilization, the U.S., especially after the removal of Maduro from Venezuela, is in quite a good position. We're an exporter. We have significant influence over Venezuela. So, this region, the Western Hemisphere, is in a pretty strong position oil-wise. The East is not. And to me, this just kind of creates more friction in the way that the oil markets work throughout the East. So yeah, something else. Okay, next story. We're going to do a quick rundown of the hyperscalers, and Vic and I discussed it. We're going to start adding the hyperscalers individually as companies into the economy segment because they just have for so long now been the lion's share of growth in the S&P 500 that they really are a significant part of the economy, right? You can't really talk about the S&P without talking about the Mag 7. You can't talk about the Mag 7 without talking about the hyperscalers, especially in the era of AI. And so even now more than ever, these companies do represent a significant portion of the United States economy. And we're going to start highlighting them in this economy section. So not just kind of the Fed and GDP, which also that was announced. And I don't even think we're going to go too deep into that because there's not too much to talk about there other than it was off by 0.3%, I think, 0.3% of the analyst expectations. But we're going to do a rundown of the hyperscalers. So Google's profit jumps 81% as cloud business booms. Artificial intelligence is lighting up every part of the business, says CEO Sundar Pichai.
Yeah, I mean, it's incredible growth. I mean, they're decent. They're not the biggest. Amazon is the biggest, but they're pretty big size. And to grow at that pace is just incredible. I mean, it's
insane.
Hard to even get
It's
my
insane.
head around it. Yeah.
Yeah, it's insane. And you know, with Google, I mean, the impressiveness of them is, well, I don't even know if I would call it impressiveness. When this whole AI thing first started, Vic, you know, you and I are longtime Google users, and you're an Android user, so you're even deeper, I think, in the Google ship than I am. You know, we both acknowledge that Google came up with the transformer, Google had the TPU, and Google bought DeepMind. So in so many ways, you know, they are the foundation of this entire AI movement as we understand it. And OpenAI obviously gets the credit for bringing generative AI to the masses and capturing that the brand equity that comes with that. But when we talk about the full stack and the capabilities, they were always going to have that breadth and depth throughout their organization. And now that we're a couple of years away from the hype cycle of generative AI coming on the scene, it's really starting to show, right? Like they were always going to be able to infuse artificial intelligence through every part of their business, which allows them to outflank, you know, or at least have an answer for pretty much everybody, right? They're not number one in cloud, but they've got a very strong answer for cloud. They're not number one in chips, but they've got a very strong answer for chips. They're not number one on frontier models, but they've got a very strong answer for the frontier models. And you know what we can't say about any of the number ones across any of those categories? The same. We can't say the same for them.
Yeah, and that's right. And you didn't even mention Waymo or other things that are. I mean, Waymo's driving around Nashville now. I haven't got a chance to ride it yet, but I want to.
I rode in my first Waymo on Monday.
Oh, you did?
In
Nice.
Austin.
Nice.
And I didn't even try to. I'm glad you brought that up. So on Monday, when I was in Austin, I took advantage of being in Austin to get a pre-Nuvo scan. And so I ordered an Uber from the hotel, and they were like, hey, you know, you can get a Waymo. Like that's the fastest one that's available to you. So I rode in my first Waymo. You know, I have to say, there was one moment where like it stopped and the brakes hit a little hard. You know, it was the kind of situation where I think a human would have like eased on the brakes, and it was a little unfun. But at the drop off point, I mean, it navigated a pedestrian crossing the street, a very narrow pathway, a car that was double parked. I mean, it was a pretty confusing setup.
Yeah.
And I've watched the system figure it out, Vic, and like figure out how to get to a parking space. It was pretty impressive. So yes, Waymo 2. All right. Amazon posts double-digit growth anchored by booming web services. They jumped 17% with a sharp increase in net profit.
Yeah. I mean, they're the same. They're probably double the size. Google was roughly $20 billion in cloud services, and Amazon, in this article, it says they're $43.2 billion just in the first quarter, which is hard for me to get my head around, but they're huge.
It's ridiculous. And then Microsoft, they had strong cloud growth. You know, Copilot I'm even starting to hear it in the enterprise. Like while I was at HFMA, I mean, there was lots of murmurs around how folks are turning on Claude, right? Because Copilot's just not getting it done.
Not as good. Yeah.
No, it's not getting it done. But having said that, their cloud growth obviously is fantastic. Sales reached $82.9 billion in Q1, exceeding Wall Street expectations.
Yeah. The cloud is, we talked about this last week related to Oracle, I think. We're going to have a shortage of inference if we don't already have a shortage of inference. So Microsoft's cloud, everyone's cloud is going to be really strong. The other thing that Microsoft has, that yes, Copilot is average. They've struck pretty good deals with Anthropic, where the only system embedded into Excel and PowerPoint is Claude. Maybe they have Copilot. I haven't tried to use Copilot, but I haven't been a big user of PowerPoint until this year because I prefer Keynote.
Right.
But Keynote doesn't have any support. I'm having to like do all the little changes to the format myself, and it's great. And so I'm using Microsoft PowerPoint now again because they have partnered with Anthropic, and it's easier.
You know, it's so funny that you say that because we just had our board meeting and Claude Design just came out, and came out in time for me to knock out our board deck with Claude Design, right? And while I was doing it, I was thinking, you know, Apple is so behind on AI that this really might be where I give up Keynote.
Yeah.
For the same reason, right? I mean, we talk every day about how we're getting off of Google Sheets and getting into Excel because Excel has that Claude integration,
Right.
and Google Sheets has been really slow to roll out their Gemini integration with any level of quality that you can really do the same level of work. And so, yeah, it's getting to this point where if your core software is not sufficiently AI enabled, it really is going to be on the chopping block. I mean, it's incredible how fast that's happened.
Yeah, that's right. I mean, I would prefer to use Keynote, but the acceleration of me letting Claude do the first iteration and then even some cleanup things where I don't have to do it is just much better. All the things that bother me about PowerPoint, Claude can take care of.
That's right. That's exactly right. That's exactly right. All right, let's go to the VC rundown. So first, Axoft raises $55 million Series A to advance brain-computer interface technology. I love keeping track of this whole brain-computer interface movement because healthcare is ground zero for it, right? Addressing all matter of neurological disorders. And so see what we can read here. So Series A led by CP Group Innovation, bringing their total capital to $60 million. So clearly the seed funding up until this point was only $5 million. They're going to use this to expand their global clinical trials, pursue U.S. regulatory approval, and build a GMP facility for their implantable brain-computer interfaces. They were founded only in 2021. So that's kind of the same time that the Neuralink really started to make real splashes. Coming along with that, I wonder, obviously Neuralink is privately held and part of Elon's universe. So I don't know how much money he's put into it. And we haven't heard from him on Neuralink in a little while, which does not mean it's not going. Simply means he's been pushing Optimus much more. And Grok and SpaceX and all those things. But yeah, look, I think we're very, very close to this whole brain-computer interface thing becoming something we're all going to have to consider.
Yeah, and they also created their own material, which is over my head technically, but they created this material to be able to sort of interact with the brain, I guess, more closely and for longer periods of time. So I don't really know the details of it, but that seems like a proprietary advantage for them if it actually works.
Yeah, and I think that's also, it's interesting, right? I think that's also going to end up being one of those things that seems like it would be esoteric, but because we're talking about implanting something into the brain, I bet it makes it into general population discussion, right? Like, what is the material? Is it synthetic? Is it organic? Like, how does it come about? What's the likelihood of infection? Does it have to be replaced? Like, I think there's going to be a lot of discussions around that. So I'm glad you brought that up.
Yeah. I mean, I don't think we know enough right now, but they're saying it's the reason for using it is it's more compatible with the human tissues.
Yeah. All right, Photon, $16 million raised to modernize prescription infrastructure and return transparency to patients. So I think this is a category that's just going to keep heating up because PBMs and verticalized payers are continuing to be under attack from the legislature. So this is an end-to-end prescription infrastructure company. They raised $16 million. Healthier Capital led it. About participation from Notation, Flare, and Evidenced. So, good names around the table. That to me signals not just that this company is good, but I think also when you look at that amount of capital, 16 million, and you look at Flare Capital participating, that tells me that this is an emerging opportunity space. Like, it's not yet saturated because that's not really a very big check from Flare if they didn't lead this round, right? So that's a good signal for me to dig in more on this space.
Yeah, that's right. And e-prescriptions, I forget the name right now. I was just trying to think of it, but I can't. It's pretty dominant by one provider that does a lot of the e-prescriptions. And so it'll be good to have some competition in there, I think.
Aidoc banks $150 million backed by Goldman Sachs to scale clinical AI foundation model. So here we go. Yet another one of these foundation models that's clinical grade, $150 million in funding, less than a year after the same amount was raised. So, these big foundation models, they eat a lot of capital. This is a space that I just can't get that comfortable with because I struggle to see how these super large hyperscalers. For me, here's my investment thesis work on this, Vic. And I'd love to know whether or not you're thinking similarly. These hyperscalers are struggling to monetize, right? And even though Claude is crushing it in the enterprise, they're still burning capital, right?
Yeah.
They want to IPO. There's all sorts of fears about whether or not they're going to get the compute, whether or not what they have is defensible, open source models, all these things. And of course, there's this big, dumb, huge sector of the economy called healthcare, right? And I just think the idea that they're not going to go after that and point their billions of dollars that they're raising at that market opportunity at the highest level, I'm just like, there's nothing that helps me to see why they wouldn't do that, right? How could I sit in the boardroom of Anthropic or OpenAI and say, guys, we got to leave healthcare alone? It's just like, just makes no sense.
There's no chance of that. I mean, I don't know what it is now, but a year ago, it was over 40% of all the prompts coming into OpenAI. And so it's a huge market. It's ripe for disruption if you're sitting in Silicon Valley. You and I know there's a lot of complexity. Our audience knows this complexity, but they're going to keep pouring money into it. And I think it's great that Goldman Sachs is supporting this, but I think it's risky for all those reasons. I mean, they have money to burn to grab market share. That's sort of the playbook for those groups. So.
Yeah. And at the same time, and I think this is, part of the thesis we're pretty bullish on, right? Which is healthcare is so complex, so it has so many facets to it that there are endless application opportunities.
Right.
Endless. I just think there's so many places that you can wrap a well-informed, contextual workflow management harness of software around these foundational models to deliver value to the healthcare industry and compete and win in a way that is, if you look at the paths that Claude and OpenAI are taking, they're looking at broad swaths, right? Like Claude Design. And it's like Claude Design is not going after just PowerPoint and Keynote. It's going after Figma. It's going after, Photoshop. It's going after all design tools, right? It's going after all design tools. Claude Code, it's going after the entire ecosystem of coding tools, all the IDEs, all, everything, all the auto-generating code tools. Autocomplete, et cetera, et cetera. So, what's the likelihood they're going to build something that's specifically focused on, I don't know, some health needs assessment report that, federally qualified health systems need? It's just like, they're not, that's like probably a 9 to 10 figure opportunity that you could go after, So I don't know. For me, I just think finding those very specific pain points where who the buyer is right now, and you can wrap these models that are going to forever improve with some really, really specific software to solve someone's problem. That's where I want to invest.
Yeah, and my view is the foundation model competition is over, right? Like there's benefits to scale and networking. So as Anthropic, OpenAI, Google, and all the Chinese platforms, Grok, as they get more and more user information, they feed that into the next model and it gets better and better and better. And simultaneously, the price compression, like it's cheaper and cheaper for tokens continuously. So Aidoc is jumping into this space. They're not the first one in the space of clinical AI. And I agree. I don't think now 2026 is the year to start a foundation model in any domain. Yeah. I think it's more likely to assume the inference cost is going to come down lower and lower for smarter models and build on top of that. But of course, that's my own book too, so I'm totally biased.
Same. That's my book too.
Yeah.
My book too. Moving on to policy. FDA turns to AI to speed up clinical trials. This is Wall Street Journal Pro. What you got here?
Yeah, so for a long time, we have been handicapped by the clinical trials data collection process. It's time consuming for a patient to join a clinical trial, drive over to wherever you have to go, do all the intake, get tested. And so it's very difficult to get patients to enroll, and that slows down the testing process. And FDA now is sort of using AI and moving into what's called real world evidence, where they use the existing data in the electronic health records to understand sort of the impact of drugs in a way that doesn't involve as much data entry, as much patient interaction. And so there's a lot of details that need to be worked out, but I think it's great that the FDA is leaning into this. You and I were over in London, or maybe Manchester, talking about this 9 years ago. The US has been behind because we have data in all different health systems, and it's harder in Europe, in the UK. It's all in one place. They have nationalized medicine, so they have the data. But the FDA taking leadership in this, I think, could be really powerful over time. So we'll see, but I think it's pretty promising.
Yes, and I think it also is worth noting that the FDA appears to be hitting a stride. This is sort of 2 weeks in a row of really positive news coming out of the FDA of this nature, right? Of what I would call modernization of the agency's protocols. And that's great. That's really, really good news because for a while there, the only stories we were covering were staff departures.
Right.
And so it's great to sort of see more stories being around their addressing of AI. Trump withdraws the nomination of Casey Means for Surgeon General. I think this is ultimately going to end up being a win for the Trump administration and for HHS. I think Dr. Means was just, because of her background, which was a little more media than clinical, was highly critiqued, and probably from all sides, which is why she was not going to get through Congress here. But I just think that this is a good move, and instead he's going to be nominating Dr. Nicole Safir, who's a radiologist at Memorial Sloan Kettering Cancer Center. Much more, much more practical.
Much more credentialed.
Yes, much more practical, credentialed, nominee. So, yes. I mean, do you have more to say about this? I mean,
I think that's right. What I've noticed is he has been trying to nominate people that can kind of carry a message through the media and to the public in a way that is strong. And I think he maybe over-indexed with Casey Means for that. She's a good communicator, but she wasn't as sort of credentialed as people are used to for the Surgeon General role. That typically is the top physician in the country role. And so that may not be the best place to put an influencer in.
Yeah, and look, I mean,
maybe that's not fair, but the new nominee is much stronger.
No, I think that. No, I think that's fair. Casey Means is a media personality, right? I mean, I don't mean to say she's not a doctor, but she is certainly a media personality. And, she was probably likely to be in a very similar bucket to the departures or like highly questioned members of his cabinet, such as Pam Bondi, Kristi Noem, and, Kash Patel is a bit in the hot seat right now, right? And his background was media personality, right? So I think moving away from this kind of like media bent into more industry stalwart who may still be ideologically aligned, sure, but like...
Yeah. Besson is a very deep Wall Street experience, but he also can go on CNBC or go on any media and carry the Trump message. That's an example where he was able to get both. I think in this case, he might have gone a little bit more towards the media talent than was warranted.
That's right. Okay, Cigna to exit the ACA market, pursue strategic alternatives for eviCore unit. So this is our first payer story. And Vic, it just seems to me like maybe Trump doesn't need to even talk about Obamacare anymore, because if Cigna is nationally exiting the market, and this, and Cigna is a pretty high quality health plan company, and they're not in government pay, right? So for me, I as someone who's a business person, but also, effectively self-employed, Cigna's a brand I look to and I'm like, hey, I would like to have the option of shopping their plan, right? That's an option I would want in my consideration set. If that option is out, like, I think that from a credit rating perspective, it just deteriorates the perceived value of the market at all. And who else is going to do this? Like I didn't even know this was necessarily even possible, that you could just like opt out of the whole damn thing. So I don't know. This seems like a lot.
Yeah, I mean, I think it's fair to say I was shocked. I was really surprised about this story. I did not see it coming, and I agree. It's surprising that they would move away from it completely. But I think you're right. It's a sign that, for better or worse, I think it's probably for worse. The Affordable Care Act is fraying. I mean, I don't know how many payers are left in it right now.
Yeah. And then eviCore was recently in the news in a bad way. They were kind of pointed out for some of the fraud, waste, and abuse, and it looks like they're just going to be on the chopping block for that very reason. It looks like Cigna's just not willing to let this right. unit take down the ship. And so that to me is a lesser story, because we've clearly seen all the payers are doing what's necessary to stay in good graces with this administration. But the ACA market exit piece is huge. That's a huge, huge story.
Yeah. That's right.
Centene swings to $1.5 billion in profit as the Medicaid business improves, even as the ACA membership falls by 2 million. So I think it was probably a year ago when Trump was really starting to roll out the hits and target the managed care organizations. Centene projected that last year was going to be very, very difficult. They were reporting big losses, but I think they kind of said it was going to take them a year to clean things up. Last week we gave the readout on Molina. They did not fare as well, but Centene, $1.5 billion profit and an MLR of 87.3.
Yeah, and they talk about in the article, they are really focused on controlling costs. The way they said it was pulling multiple levers around network optimization, scaling clinical programs, to do the work of sort of securing payment integrity and reducing fraud, waste, and abuse, which everyone always puts in there. So, right. I mean, they're focused on controlling the spending to get the MLR down, which is maybe their job, but it has been hard to execute. So
yeah, and look, this is all going to flow downhill to some degree, right? I mean, I think if we look across the board, the payers have had a good Q1, which means that they got the memo in 2025. They have made the necessary changes to at least be viable again. They are viable again, kind of across the board. Now, interestingly, I think we also are seeing that the large platforms, your HCAs, even though they're looking at next year and they're like, doesn't look that good in 2027 because of some of the fallout from the One Big Beautiful Bill. But, we did have some great readouts from the big health systems. Actually, the industry is doing okay right now.
Yeah, that's right. And I think, HCA's game plan is to deliver this quarter's results ahead of estimates and then talk down the future quarters. That's just what they do. So whether they're actually seeing concerns or they just are sort of scripting that it's hard to tell from the outside. But I agree that it's the big platforms, they've been able to weather this storm and kind of navigate it. We'll see how it goes. In the rural settings, in the poor, the Medicaid businesses, I'm a little worried about access and sort of patient quality care, but they're holding on right now, at least.
No, so I'm glad you said that, because we're saying that the industry is doing okay, but that's a very K-shaped thing, isn't it?
Yes, that's right. Yeah,
right.
People are deciding to opt out of the Affordable Care Act, or they lost their Medicaid because they have a job where they can't produce evidence that they're working. It's under the table for a construction firm or whatever. So there's many more people, I think, although we don't have clear stats, that are not covered. And when they get injured or get sick, they're going to show up in the ED and become uncompensated care. That's going to happen sort of back half of this year, early 27. So we'll start to see those things pop up over time.
Agree. Humana teams with Mark Cuban's Cost Plus Drugs company. This article from Healthcare Finance News, which is HIMSS publication, it was a little hard to decipher, but basically it looks like Cost Plus Drugs and Centerwell's Pharmacy are partnering, and it looks like it's bi-directional in some way. So Cost Plus Drugs has created a SaaS platform called SwiftDRx, and Centerwell is going to use that. Also, I guess Centerwell is going to probably purchase a fair number of their drugs. I can't say if it's going to be all, but they're going to purchase a bunch of their drugs from Cost Plus. So it looks like this is kind of a bi-directional partnership that's going to share data, is going to share, best pricing possible. And I think this is pretty interesting, right? Humana, they don't really have the vertical PBM capability. They have the pharmacy bit, but this is a really, really smart way for them to, I think, align with something that's going to be popular with the public, because I think Mark Cuban's a public advocate for lower costs of healthcare. I think it probably aligns well with the Trump administration as well. It strengthens their position in their market with their vertical stack from the health plan perspective all the way through to the provider segment.
No question. I don't think they have a PBM, and this allows them to avoid future concerns coming out of DC or other places about the PBM business model by pointing to Cost Plus, which has a much more simple business model. I think it's smart. Humana they're not relying on PBM profits already, and so this gives them a kind of an easy way to avoid that and, maybe benefit relative to other payers.
Agree. Universal Health Services Q1 2026 earnings growth dampened by volume hits. UHS, we've noted they really are at the end of the day a behavioral care provider. They have acute, but it's not the high performing part of their business. It's not really the growth part of their business. But it looks like this quarter it actually dragged business. The acute care part of the business didn't perform on the volume side, and it'll be interesting to see how long they continue to hold on to that part of the business. But in the prep for the call, you noted that who's really willing to buy it.
Yeah, that's right. It's two different businesses that are slammed together that don't really fit together all that well, and the behavioral side is growing quickly. Has unfortunately a lot of demand. And that's a different property to manage than their acute care facilities that are not that way. They're having lower volumes. But as I said to you earlier, I think there's not a lot of buyers for their acute care platform. I don't know who would be the buyer. So I think they're just trying to weather through it.
Agree. It's time for the Lilly deal of the week.
Yeah, we need Lilly to sponsor this segment now. They're always on.
Vic, They don't need to. We keep saying their names.
Yes, that's right. I guess that's right. Yeah.
Eli Lilly to buy Ajax Therapeutics for up to $2.3 billion. More on the blood cancer portfolio side.
Yeah. And they're just building this incredible inventory of really promising drugs that it's been 4 or 5 weeks in a row they're acquiring things for 2, 3, 4, 5 billion, which used to be a lot of money. Now it's just like they're sort of stocking the cupboard, and I think it's going to be really exciting next 5 or 10 years. They have a big portfolio of drugs.
Yes, they really do. It is. I would say it must be a great time to be in the cancer drug or biotech space right now, right? With Lilly out there on this spending spree, and then, of course, the other pharma companies trying to keep up. I mean, because when this kind of activity happens, as you know, it forces the other market players to have to act as well, right? I mean, they can't just sit there and let Lilly build this backlog of assets, and do nothing. So I think it's probably starting to create a real seller's market.
Yeah, I think for the right price. I mean, once you get over some level, I think it's hard. We have another story to talk about that, but at this range, sort of that $2 to $10 billion, I think it's a seller's market definitely.
Yeah, fair point. To that note, these larger deals, Sun Pharma, which is an Indian company, is buying a U.S. healthcare company, Organon, in an $11.75 billion deal. Vic, what's the deal here?
Yeah, so I was excited about this one. Sun is, I think of them as a generic producer in India, and they do that really well. They have a lot of products, but they're not brand names. They're low-cost generics that are off the IP protection has expired in dermatology, eye care, skin cancer. They have a bunch of different products. I mean, they're pretty large, but I think it's great that we now are going to have an Indian headquartered company owning Organon is a branded, sort of protected property. And so they're now moving out of generic only, and I think it'll be good. They have a long way to go to compete with Lilly, but having a global platform that can be another buyer for these products as they grow up and come out of biotech is really healthy. And I'm excited about India beginning to strengthen its proprietary healthcare tools. So they've always been great in generics. And we talk a lot about China sort of moving up the stack from sort of fulfilling their more hardware, but then they take those skills and start designing new products. That could also happen in India, and it's starting to happen. And they're, obviously they're an ally of ours, so that could be really good.
Yeah, I think this is great. I think this is great. There's a revolution in cancer, but can big pharma afford it? So I think this is a story you were referring to when you were talking about it really does depend on the size of the deal. This is in the Wall Street Journal. Byline is, Revolution Medicines could soon launch a pancreatic cancer drug. Its stock may already be beyond what established pharmaceutical firms can pay. What's really the storyline here?
Yeah, so they've grown revenue. So they're successful. They've grown. Their drugs are doing well, and they were in talks last year with Merck and AbbVie. It didn't come through, but for evaluation somewhere around 25 to 30 billion, fell apart, and then the stock has grown significantly since then. So they'd need to find a buyer at 30 to 40, maybe even a little over 40. To make it attractive to the shareholders. It's a publicly traded company. And so they're in that kind of middle ground where I don't know if they're big enough to be a global platform on their own, or I don't know if they have enough variety, enough portfolio of different products, but they might be a little too big to fit into that like really competitive market of 2 to 10, 2 to 11, somewhere in there. So that's what the story is about. There aren't that many. You can list sort of on at least two hands, maybe it's in one hand, how many buyers, could afford a $30 billion, $40 billion acquisition.
So here's a question. I mean, is there room for a net new commercialization platform out there?
I mean, I think there is. Go down a little bit. You can see the stock chart on Revolution, RevMed. They're going pretty fast.
They're going pretty fast. Yeah.
So, I mean, I guess it depends. They need to diversify, right? They're pretty narrow in their portfolio, which makes it difficult to be public, for long. Because if a competitor comes in, it's just risky to not have a portfolio like Lilly, Merck, Johnson & Johnson do.
Yeah.
But that's kind of why I was excited about Sun. I mean, they now are getting to be big enough where they could be a real player in this, which would be healthy, I think.
That's a storyline we should watch over the next year, because I think you're making a good point. It probably is time for a new player or two in the pharma market. That's a buyer and a commercialization platform. I think that's right. Yeah. So Health and Us, we're all talking to each other less than we did a decade ago. This is a story from the Wall Street Journal. Texting, online ordering, and tuning out with AirPods means fewer chances to talk to loved ones and strangers alike. Yeah, I certainly feel this. I think that while that's true, I also think that there's a level of busyness, that's happening right now, and a pace of change and information that also dials us in. Now, again, I don't know that you can say that's true for everybody, because maybe a lot of people are just scrolling on social media, right? And maybe it's not work related or productivity related, or information gathering related. Maybe it's just entertainment. But I think the net result is the same and is correct. I didn't always walk around with AirPods in my ears, and now more often than not I do. And so, yeah, I think there's something to this. How do you feel about this, like in your day-to-day life?
Yeah, I mean, I think it's sort of a thing that is every month, every year, slowly creeping up, where like I'm definitely texting more, listening to podcasts more, less kind of chatting in an elevator, in line, waiting for lunch or whatever. I used to just like be bored and you end up chatting with someone who's there. And I think it's just worrisome. I think it leads to less connectivity with our community, with our neighbors, with our coworkers, with our schoolmates. You get out of the habit of it, and it can lead to loneliness and lots of other problems. How we turn it is not really clear. I mean, I think these are trends that are pretty well established, but at the same time, it's worth watching.
I think that's right. One thing I wanted to bring up about this, the role that a particular society or culture plays in this, and I don't want to say that I think this is distinctly a United States phenomenon because I'm not well enough traveled globally to be able to make that kind of assertion. But I do have, I think, at least a reasonably unique perspective in being someone who spends a significant amount of time in two different countries. And I can tell you that I do, even though I have a language barrier, I do talk more often to people in Mexico. I see people wearing AirPods walking down the street more in the United States than I do there. And, I made a comment to someone on Monday because we were talking about Waymo, right? And I was like, yeah, Waymo's got no shot in Mexico City. I rode in the Waymo and it works because, driving here is pretty orderly.
Yeah. Americans follow the rules generally.
Yeah. And it's like in Mexico, you have to pay attention. I mean, it's a very sort of engaged process. It's not just rules. It's you're kind of in a dance or a conversation with every other person on the road, and it's like when you get to an intersection, who gets to go first is a negotiation. It's not not a clear cut decision. And so that cultural difference, I think, actually forces more engagement. It forces more talking to the other person, and it's embedded at a cultural level. So, I think I certainly do experience this to be true in the United States, and I'm sure it is true in other places as well. But the degree to which it has impacted society probably differs based on the culture.
No question. And I think even in different parts of the U.S., I think it probably is different. But my opinion is it's trending to less verbal and even nonverbal communication and moving more towards asynchronous text, but maybe start at different starting points. So we might be worse ahead of Mexico, but I think we're all trending in that direction.
Okay, and this just reminded me of one other thing. This literally just happened. Okay, so you see this coffee cup here? Luckin Coffee. Okay, so I'm very sleep
You're
deprived
in New
at
York,
the moment.
Right?
I'm in New York.
You're in New York, yeah.
Yes, I'm in New York. I'm very sleep deprived right now. And so I am drinking a matcha, which I almost never do because I don't want coffee jitters, but I need a little energy to get through the night.
Yeah.
Right. I need a little energy to get through the night. So I walked into the store, Luckin Coffee, and I tried to order that matcha. And do you know that the barista said, I'd be happy to get that for you, but you're going to have to order it through the app. We only take orders through the app.
Yeah.
And
McDonald's
I'm
is like that now. Yeah.
Vic, I'm in the store.
Right. And you have to pull out your phone. Yeah.
I download the app. Yes. Yeah. I download the app.
That's terrible customer service.
I set up an account. I order through the app. Here comes my matcha. And then at the end, it's like, would you mind just scanning this QR code here? Dude.
What happened to just greeting you when you came in? What can I get you? And then you pay cash. I'm old fashioned. Those days are over.
Yeah. Yeah. So anyway, I think I'd have to say this article really does ring true for me. And I think it's sad and I don't think it's good for us. I find myself on the weekends now, when my wife and I are together on the weekends, we tend to take the mornings and just call our people, and just try to spend 2 or 3 hours just going through some group of people, children, friends, parents.
Yeah, just connecting, catching up, what's going on. Yeah.
Yeah, and just doing old fashioned phone calls, not a video call or anything like that. Just like trying to get on there and have a conversation, and it really does feel good, to do that.
And you have to be intentional about it. You have to actually carve out time, and then I think it pays off. And then the next week is even better because you get through that kind of like catch up things, and then you're just sort of bonding and talking about the week.
Yeah. Exactly. Moving on to the crypto Web3 section. Robinhood profits rise on boost from prediction markets and gold subscriptions. However, their results fell short of Wall Street's expectations. What's the deal here?
Yeah, so we were talking earlier about how HCA often sort of manages the messaging with the analysts. I think Robinhood did that very poorly because they grew significantly, but it was not as fast growth as the market had estimated. The revenue grew at 32% compared to last year. So it seemed pretty healthy growth, but it wasn't as much as they had signaled to the market. So the stock sold off. So, in general, I think Robinhood is sort of in this Web3 crypto space that they and Coinbase are sort of the two front runners. But if you go down a little bit, you can see the stock market chart. They got maybe way ahead of what the actual value should have been.
Yeah.
And now they're sort of building back slowly.
Well, here's the thing. Robinhood, I think what the market is realizing is that Robinhood doesn't have any real differentiation other than great brand and very, very slick user interface, right? The user interface is exceptional. It really is. But under the hood, there's not that much differentiation. Coinbase is markedly more differentiated under the hood than Robinhood is. And I think that might be what's going on here, is that the market is saying, you guys are not that differentiated, so we're actually really need you to see the results. We need to see that brand paying off in a more meaningful way on a quarter-over-quarter basis. And so I think they might continue to struggle with this storyline. We'll have to keep watching it. Crypto rushes to bail out decentralized lender targeted by hackers. So this is definitely in the weeds. I want to try to make this not so in the weeds for our listeners. But basically, there's been a rash of hacks that have hit a variety of different DeFi platforms. It doesn't help that these hacks have all sort of happened after the announcement of Claude Mythos. That it just doesn't help that now we have AI out here that can find these hacks, and now these decentralized finance platforms are being hacked on a regular basis. And many of these platforms are backed by decentralized lending platforms that have significant locked up capital. Aave is probably the leader in that space on the Ethereum network. And Aave has suffered $10 billion in outflows over the last 2 weeks as a result of all these hacks that are happening to the platform. There have been real concerns about, for people who have their capital locked up with these lenders, hey, when can I get my access? It was not like a huge amount of bad debt, but it relative to the total amount of capital that's locked up. But it was, a couple $100 million in bad debt that Aave was left with. And so what has happened, there was all sorts of threats of lawsuits and things like that. I guess there was probably a group chat that got started, amongst all the big players. And they started this thing called DeFi United, and they've all been donating big amounts of ETH into the pot to kind of make all of the people whole so that the bad debt can be erased. And it's a pretty impressive response initiative. It's going to carry its own debate about whether or not this is in effect a bailout, and that kind of goes against some of the crypto principles. But it's interesting to see as crypto matures, it ends up behaving just like traditional finance in so many ways.
Yeah, no question. And I think the reason this story is a little different in my mind is that Aave itself was not hacked. Their system was not vulnerable, or at least it wasn't actively hacked. It was a North Korea group that was able to hack another DAO I'd never heard of, Kelp DAO. They were successful at stealing about $230 million in ETH from Kelp DAO, and then they used that to borrow money from Aave, which is something you can do. If you bring ETH, Aave will loan you. That's their business. They'll loan you money. I think it's like a run on the bank kind of thing. Like Aave itself was not really compromised. They had this bad debt problem because they took in stolen ETH as collateral. But I think that's why other people have sort of come to Aave's rescue, because it really was a confidence thing. People were nervous. They didn't understand the whole story. They just wanted to get away from Aave. And I think there's like 10 billion that was trying to get out of Aave. And so it's a confidence thing. So the rest of the industry stepping up and being supportive, it helps cash-wise, but I think it also helps that run to stop. And people just like, well, if these insiders know what's going on and they're putting money in, I don't need to go through the hassle of moving my money.
Yeah, agree. It's going to be something fascinating to watch. There's a lot of different aspects to this story that are new, that are new.
Is it Aave's responsibility to check if the ETH is fairly obtained? Maybe. I don't know, but they haven't had to do that previously.
No, but like all of a sudden, that's kind of like, it's not very permissionless, is it?
I mean, no. And you're going to have to report where you earned the ETH from, and that sort of goes against the whole ethos of crypto.
Yeah, and I think this is the thing, right? Like, I think the crypto industry is starting to understand why traditional finance has all these rollback mechanisms and has all these regulations and has all these front end checkpoints before you can enter the financial system. You know what I mean? Because bad things can happen.
Yes. And North Korea is constantly probing and trying to find vulnerabilities in every company and in a lot of healthcare companies. And they have a lot of tools. And so it's going to keep happening.
All right. Ready for the AI rundown?
Yep.
All right. In a real world test, an AI model did better than ER doctors at diagnosing patients. This ended up being published in Science. So this is a real study. TK, I think, was maybe the first to put us on to this. Tarun Kapoor, who was the chief digital transformation officer at Virtua Health and has been on the show several times. Got to get him back on the show. Just hung out with him at Health Evolution Summit. He was a doc and a practicing doc, and he was the one who was like, listen, these things are better than us,
Right.
and as and they're going to end up they are going to be an accelerant because they're going to advance medical knowledge at a rate that we're not going to be able to keep up with. Right. So
no
we're
question.
not going to be exempt.
This is not a sort of a fly-by-night test. It's Harvard Medical School and Beth Israel, and they tested a bunch of models, but the most powerful one was OpenAI's O1, which is, we don't even talk about it anymore, is not cutting edge today. But that's the best model they had because it was a 18-month process to study it. That's the model that beat humans, never mind Mythos and Opus 4.7 and ChatGPT 5.5. I mean, there's better models, and they're going to keep getting better. And the humans we don't have the capability. We have other strengths, but we're not going to keep up with the models.
No, we're not. I mean, doctors, they certainly have this class as sort of an elevated workforce above other humans, but that is not going to make them exempt against AI. It's just not. We'll have a link in the show notes to the Science article. Some OpenAI stories. OpenAI misses key revenue, user targets, and high-stakes sprint towards the IPO. Company's CFO and board have questioned the wisdom of massive data center spending in the face of slowing growth. OpenAI, I think we've given them credit over the last couple of weeks on the product side, the focus, winding down Sora, really nailing Codex, the ChatGPT for healthcare. These are all good moves. But, is it a little too little too late?
I mean, OpenAI has forever been like, a classic Silicon Valley, all gas, all growth, and we'll figure it out later. And that might work if they have some bumps in the road. They don't have a lot of room for error. And so I think this is overdone, but they did miss revenue growth and user growth as compared to what they had predicted. And so they're still growing, but not at the rate they were talking about. And then there's a lot of questions about their data center spending. To me, that doesn't make sense. We just covered the earnings this week of how crazy the data center usage is. So I think anyone that owns partnerships and data centers are going to do fine. But it's going to be touchy until OpenAI gets public because they're somewhat fragile. They burn a bunch of money, and you can't keep raising private money forever. The other thing that I'm watching that we'll have to see is that a lot of the money, certainly there's other sources, but a lot of the money that would be supporting these really big public offering, right? We're going to have SpaceX, we're going to have OpenAI, we're going to have Anthropic. They're all huge IPOs. The Middle East sovereign wealth funds have been a significant source of capital.
Yes.
And they're distracted, and the oil's not flowing. They have lots of other issues right now. So I don't think they're long-term going to be not participating, but in the next year, they may be distracted. I don't know. We'll see.
That's an excellent point. That is an excellent point. More bad news for OpenAI. They've been sued by 7 families over a very unfortunate mass shooting that happened in Tumbler Ridge, British Columbia. Terrible story. School shooting. 8 students, 5 children shot. One was a 12-year-old, shot 3 times. 8 people killed. Terrible story. And OpenAI failed to flag the shooting suspect's ChatGPT activity.
Yeah, it's even a touch worse than that. They flagged her. I think it's a her. They flagged her.
It's a transgender woman.
So I'm not sure the right pronoun. OpenAI flagged their activities as needing to alert law enforcement internally, but then they didn't actually do it. They elected not to do that, which is not a good fact pattern. It was a couple months before the shooting. So it's going to be a hard case. Yes,
it is. I mean, these. I wish that these stories were just going to kind of go away, but I don't think that they're going to. So it's tough. Elon Musk testifies that he was a fool to fund OpenAI. So we have a lawsuit going on between Elon Musk and Sam Altman.
Yeah, that's right. Musk is claiming that Sam Altman and Greg Brockman inappropriately changed OpenAI from a nonprofit to a for-profit. I think that's a factual statement. He's arguing that they should revert and go back to that. I think he has a pretty good case, so we'll see what happens. But it's at least a distraction for OpenAI, and it could be, again, it could really be difficult for their IPO unless they can get a good decision here.
Yes, and in the court of public opinion, in the world of AI, Elon also happens to control the number one distribution platform that discusses AI on a daily basis, right? So It's like there's so many ways for him to win in this, even if he doesn't win in court. It's it's a rough run for Sam Altman. 2026 has not been kind to him, that's for sure. And then huge story: China bans Meta's acquisition of Manus, which is one of your favorite tools, Vic, on national security grounds. And the deal was already done. Meta already acquired them. They were already the Manus team was already part of Meta's executive leadership team.
Yes, and they moved to Singapore. But it didn't matter that China is claiming that it was created in China, which is true. Which
is true.
And China has a lot of strength, and so they are not going to allow it to go through. And I think this is going to be a trend. I mean, America and China are competing for AI dominance, and I think it's going to be very difficult for American companies to buy Chinese companies.
Yeah, this is, and by the way, Vic, Benchmark was a huge check in Manus once they moved to Singapore. So there's all sorts of chilling effects that come with this. Now we'll see how much of this is just creating a negotiating chip for the big summit that Xi and Trump have 2 weeks from now. But man, as of right now, Meta is preparing to have to undo the ban. Right, they're preparing to have to undo the ban. So undo the acquisition. So just crazy. More crazy news: Taiwan court is handing down prison sentences over the former employees that leaked TSMC trade secrets. They're getting 10-year prison sentences. So brutal consequences here for this employee.
It's corporate espionage, but jail time is a whole different level. So I think China is sort of flexing its muscles and sort of, I don't know, drawing its boundaries, and nothing's going to get out of China.
No. It's. I mean, if we needed a reminder that China is not a capitalist society, here's our reminder.
Yeah, right.
Here's our reminder. Right. And final story: Gemini finally allows you to issue a prompt and get an artifact of docs or sheets or slides or PDFs out of your prompt. It's only been, I don't know how long, well over a year past Claude being able to do this, that we can now do this in Gemini.
This is, I'm excited to see it, and it's 18 months later than I would have liked, but that's how Google is. They're doing, we talked about it earlier in the show, they're doing so many different things that it takes them a while to sort of get around to productizing something quickly enough to sort of grab market share. But then they end up getting market share because they have all of the, I mean, our whole company's on Workspace. So it would be easiest to use the Google platform if they would just get their act together. And so they're slowly working on it.
Yes. So I'm very happy about this. I do have to say, I think they helped Claude because Gemini was so slow. Because I remember when like Claude first rolled out the connector into Google Drive, like when they first did it. And I was like, that's cool because, at that point, both Gemini and Claude had a connector. But since then, like Claude has lapped Gemini like 30 times, right, in terms of like everyday knowledge worker usefulness because of simple features like this, right? Yeah. But over the course of the last 30 days, we've seen Gemini now have a desktop app, and now you can, and it seems like they've now gotten around to taking Gemini a little bit more seriously as a harness product and not just a foundational model. And I think that's exciting because, we already pay for Gemini. It's part of the whole Google Workspace setup, right? And it's like, look, if Gemini can keep getting better and keep getting competitive, I think you and I would both like to have a very, very, very viable alternative to Claude.
Yeah, and I've been using Gemma 4, which is their open source model. I'm now going back and forth with DeepSeek 4, which is better, but Chinese. So I don't want to for the last topic that we just talked about, I don't want to standardize on that. But yeah, Google, we need to have the frontier version, Gemini, sort of integrated with all this stuff to sort of make it actually work.
Yes. All right, man. So much to cover. So much to cover.
Yes.
When we started, we wanted to get this done in an hour, and it took an hour 15. It's just too much to cover. Well, look, I will see you. I will see you next week.
Yeah. Okay. Travel safe.
Thanks, man. Bye.